Have you ever wondered what happens inside an operating theater? This space, known also as the operating room or surgical suite, is a fascinating world designed specifically for surgical procedures. It's a hive of activity, filled with a plethora of specialized equipment and designated areas. From the operating table to the surgeon's area, the anesthesia area and support zones, each element plays a vital role in ensuring successful and safe surgeries. So, are you ready to explore? Let's delve deeper and understand what makes up an operating theater. The operating theater is thoughtfully designed to maximize efficiency and safety. It's divided into 4 main areas, each with a specific purpose. Firstly, we have the operating table. This isn't just any table, it's a specialized platform where patients lie during surgery, designed to provide optimal positioning and access to the surgical site. Next, there's the surgeon's area. This includes the scrub sink for hand hygiene, the surgical scrub area, and the sterile field where the surgical instruments are meticulously laid out, ready for use. The third area is the anesthesia area. Here, the anesthesia provider carefully monitors and administers anesthesia to the patient, ensuring they remain comfortable and unaware throughout the procedure. Lastly, the support areas are crucial for overall functionality. They include the circulation desk, storage areas for equipment and supplies, and viewing areas for observers. Knowing the layout of the operating theater helps in seamless coordination and efficient functioning. Every piece of equipment in an operating theater has a specific and critical role. First, we have the surgical lights, providing bright, shadow-free illumination to the surgical field. These lights are essential for surgeons to see clearly and carry out their work with precision. Next are the surgical instruments, the tools of the trade for any surgeon. These include scalpels for incisions, forceps for grasping, scissors for cutting, and retractors for holding tissues away from the surgical site. Electrocautery units are another key piece of equipment. They are used for cutting and coagulating tissues to control bleeding, making them an essential tool in many surgical procedures. The anesthesia machine, on the other hand, plays a vital role in keeping the patient comfortable and unconscious during the surgery. It delivers a precise mixture of gases and oxygen to the patient, ensuring they remain pain-free throughout the procedure. Monitoring equipment such as ECG monitors, pulse oximeters, and blood pressure monitors help track the patient's vital signs. This information is crucial in ensuring the patient's safety during surgery. Suction devices are used to remove blood, fluids, and debris from the surgical site, keeping the area clear and clean for the surgeon. Lastly, we have the sterilization equipment. Autoclaves and sterilization trays are used to sterilize surgical instruments and supplies, maintaining the sterility of the operating theater and reducing the risk of infection. These pieces of equipment, working in harmony, ensure the success of a surgical procedure. The operating theater isn't just about equipment and layout, it's also about maintaining the right environment and safety measures. The sterile field is a cornerstone of any surgical procedure. It's an area around the surgical site that remains absolutely sterile, where only sterile equipment and personnel are allowed. This minimizes the risk of infection, ensuring the patient's safety. Another vital element is the air filtration system. It maintains a clean and controlled air environment, further reducing the risk of infection. It's like an invisible shield, protecting the surgical site from airborne contaminants. Let's not forget about temperature and humidity control. These factors might seem mundane, but they play a significant role in maintaining a comfortable and stable environment for both the surgical team and the patient. Imagine trying to perform a complex surgery while sweating bullets or shivering from the cold. Not ideal, right? Safety measures are the unsung heroes of the operating theater. Fire safety protocols are in place, with fire extinguishers at the ready to prevent and manage potential fires. Emergency equipment, including carts with defibrillators, medications, and other supplies, are on standby to manage any unforeseen emergencies. They're the safety nets, always there, always prepared. The operating theater is a symphony of well-coordinated parts, equipment, and safety measures, all working together to ensure the best possible outcome for the patient. So, now you know what happens inside an operating theater. The layout is clear, from the operating table to the surgeon's area, anesthesia area, and support areas. You've learned about the essential equipment, surgical lights, instruments, electrocautery units, and monitoring devices. You're aware of the sterile field, air filtration system, and temperature control, and you understand the vital safety measures in place. Understanding the intricacies of an operating theater helps healthcare professionals provide optimal care to patients undergoing surgery.